working for you. This is a CBS 6 breaking news alert.
Good afternoon, I'm Cheryl Miller. We're interrupting CBS 6 programming at this time to bring you breaking news from Capitol Square in downtown Richmond. Governor Ralph Northam will present his daily update on the coronavirus situation here in Virginia. Let's go to the governor.
Thank you all for joining us today. I want to start by repeating what I said yesterday. First of all, Virginia's K through 12 schools will close for the remainder of this school year. And starting at midnight tonight, we're putting additional restrictions on establishments that serve the public. Restaurants can remain open for carry-out, curbside, and delivery service only. Gatherings of more than 10 people are banned. All recreation and entertainment services must close. Personal care services that cannot adhere to social distancing must also close. Non-essential retail establishments can only remain open if they allow 10 or fewer patrons and adhere to social distancing and increase sanitizing procedures. Essential services like groceries, health services, and businesses in our supply chain will remain open, but they also must adhere to social distancing and increase sanitizing procedures. Our businesses have a lot of questions about these new restrictions. We understand that. Those questions can be emailed to business@virginia.gov. business@virginia.gov. These measures will be in effect statewide for at least 30 days. These are not easy decisions because they will be painful for many people. But every decision we make is based on science and data. And as your governor, I take full responsibility. The feedback I'm hearing from Virginians is supportive. You understand that while these changes are difficult, they are necessary. You understand that we are fighting a biological war, and to have economic recovery, we must get through this health crisis first. That doesn't make these sacrifices any less painful. We have students who miss their classmates and teachers who miss their students, and high school seniors who are facing their last semester of school with no prom, no graduation ceremony, none of the rites of passage that should mark these big changes. And we have workers and business owners who don't know how they'll pay their bills. We're working to help at the state level by encouraging those workers to file for unemployment and have taken steps to allow businesses to apply for small business loans. But I know that this is hard, and it won't be enough to make up for the economic losses. We also need to acknowledge the emotional losses for the workers whose financial lives are now unstable, the business owners who don't know when or if they can reopen, the students whose education is upended, and for all of us. The world has no doubt changed. This will be our new normal for a while. As I've said, months, not weeks. And we need to understand that. But it won't be forever. We will get through this. We are working every day to ensure that our hospitals and medical professionals have the equipment they need to do their jobs. I am a physician, and our Secretary of Health and Human Resources, Dr. Dan Carey, comes from a large health system. We are in frequent contact with our medical providers to talk about their needs and how we can all work together to meet them. We have received the first shipment of PPE, such as masks, gowns, and gloves from the national stockpile, and we have distributed that to health departments and other providers. We expect our second distribution next week. We know it will not be enough, and this is an issue nationwide. We have the best economic development team in the country, and they have excellent contacts with private companies. We're using that network for leads to reach out to private companies to purchase more PPE. We have ordered one shipment from an overseas company. Some companies have stepped up and donated supplies, and on behalf of our Commonwealth, I thank you. We're also reaching out to other industries to see who is willing to make their supply of PPE available. For example, we're talking to dentists, to people in the tech industry, the coal industry, and tobacco companies. And we have some very promising leads from Virginia manufacturers about turning their production lines into producing PPE. Obviously, we have to verify that it is medical grade, and we'll keep working on that. Our public and private sectors are being creative. As an example, a couple of distilleries in Virginia are working on making hand sanitizer. Our Department of Corrections is making sneeze guard masks, and just yesterday they made 25,000 masks and expect to do another 25,000 today. We know our hospitals also expect to need more ventilators. That's a complicated piece of equipment, so it's not so easy to quickly change an assembly line to make them. But we are working to source more ventilators. And as different places may experience a medical surge at different times, ventilators can be moved to where they're most needed. I spoke with Maryland Governor Hogan and D.C. Mayor Bauer yesterday, and we all agreed that we could share excess capacity. We will continue to keep working on all of these avenues to ensure that our medical professionals have the equipment they need to keep us safe. Again, we are living in an unprecedented time, and we are all working together to make sure that Virginia is as prepared and as healthy as possible. Stay home, please stay home unless necessary, and continue to practice the social distancing if you must go out. Be part of the solution to keep all of us safe, especially our vulnerable populations like the elderly and our essential personnel. I want to again thank Virginians for their efforts to comply with the additional restrictions we've put in place for our public health. Now I'll turn it over to Dr. Laurie Furlano, our Deputy Commissioner for Public Population Health, for an update, and then we'll take your questions. Thank you. Dr. Furlano. Thank you.
Hi, good afternoon. Our update for today is that we have confirmed 290 cases, 290, and 7 deaths statewide. The highest number of cases are seen in Arlington Health District, Fairfax Health District, and Peninsula Health District. We did receive information from the Virginia Beach Health Department regarding a death in Virginia Beach, sadly. That was their first reported death in a hospitalized patient who had tested positive for COVID-19. It was a man in his 70s that did have previously underlying health conditions. And this was the 18th positive case of COVID-19 in Virginia Beach. And that death is reflected in our numbers on our website today. Thanks.